which port should I use for these sounds?
The front one, the one that's closer to
The
you.
frontal port.
Okay, well, while he's doing that, so we're going to talk about ADHD. So before we present anything, I want to open it up to you guys. Like, what do you think of when you hear ADHD? Like, what is that first image? What is that first like response that you have?
I think of someone who like can't concentrate.
Okay.
Just kind of just doesn't have a long attention span.
Cool.
I think of the dog in the hut who yells squirrel.
That's actually that's awesome.
I think of, ooh, shiny.
Right, you think of that just kind of like can't. Okay, so then I guess part of that too is thinking about this difference between ADD and ADHD, like what really is the difference? Well, there isn't really one anymore from what a lot of our research said. It's just kind of like a difference in terminology over time. Like it used to be more of a differentiated thing, but now it's all kind of the same thing.
Kyle, pay attention.
So this is kind of an example already of like how hard it is to focus because there's all these things. But it is that ooh, shiny, you know, hard to focus. So then another question, I'm having a hard time. Another question then is, just quick show of hands, how many of you believe that ADHD is a legitimate disability?
I mean,
So some little halvesies there.
We'll talk about that in
Yeah,
here.
we will, indeed. I think we will.
Oh, gosh.
Keep going.
Yeah.
Are we? So we're going to provide a little simulation. It's kind of hard to do, but it's not perfect. But it's going to, there's going to be a video with a passage of text that's going to be up. And you need to read that just like you would if like an old standardized test. You're reading it and there's going to be questions at the end. So make sure you really understand. And there's going to be a few things to distract you. So just, that's going to happen.
There's 6 questions, remember.
Everyone ready?
Try to rein it in.
Feel ready?
please don't.
Gangnam Style. Gangnam Style.
Okay, thank you.
John and Mary.
Oh, well, there you go.
Or
Let's,
ignore.
Who says A?
They're in London.
1, 2. Who says B? C?
Sure.
Yeah, no, I didn't get it.
Oh, good.
One.
Hey.
Who says A?
Still the one.
Pretty much everybody. B, anybody? C? I'm just going to kind of let it go now.
Yeah.
A?
B.
Yeah, that's good. Just shout it out. That'll go faster.
Well,
Oh, that actually kind of works. A little bit of impulsive behavior there.
B.
B.
B?
We got the last one wrong.
I can tell you.
I thought they were getting bread.
Who got the change in there? It did get changed because it was $2.54. And they gave her a $5 note, or 5 quid, whatever the crap.
No. Quid.
Okay. So, how confident did you guys feel in your answers there?
Nope.
That's pretty confident. Nobody felt, I mean, scale of 1 to 10.
I knew it was John and Mary, and that's it.
Okay.
Because
So
they said it
the
throughout,
basic,
repeated.
the basic stuff you got, when it got more into like details, it got kind of fuzzy because, I mean, it's a little hard to read a passage when it keeps getting interrupted and there's Korean techno playing and a kid comes in and dances around the classroom. So obviously, like, that's not a literal example of what just having ADHD doesn't mean that people just dance around the room, but it's like, it gives you that idea of like, it's really hard to rein it in and focus in on one thing because there's a lot going on and your sensor, everything's kind of overloaded. So this is a basic definition of ADHD. It says that ADHD is a problem with inattentiveness, overactivity, impulsivity, or a combination. These problems must be out of the normal range of a child's age and development. So we kind of dealt with mostly inattentiveness there. But the H part of ADHD is the overactivity, the hyperactivity. So we're going to go into symptoms in a little bit, but making it hard to sit still and pay attention. So if you have to take a test or something, it could be hard to just like be able to sit in one place for however, you know, those things can take hours and you're sitting there taking a test and that's difficult. Impulsivity is kind of just like example, if I ask you to raise your hand, if I'm asking a question and then Katie just yells out the answer in the middle of my question, that would be kind of impulsive behavior. So that could be considered part of it. But the last part that's important too, because depending on how old the children are, that can be normal. I mean, in elementary school, like when kids are still learning those parts of being in the classroom, you have to raise your hand. Like obviously, kids yelling out answers is not necessarily going to be considered out of the normal range. But as you get into high school, like we're going to be doing, it becomes a little easier to spot that. Okay, this is just a basic map to kind of show, like, it says the percentage of youth ages 4 to 17 ever diagnosed with ADHD by all these states. So it's just kind of interesting breakdown of where in the country ADHD has been diagnosed the most. So I just think it's interesting that North Carolina is one of the top states there. So, is there anything else you want to get out of that? All right, I just want to make sure. All right, so this also deals with some of the similar statistics. Does anybody have a guess out of what the two different colored bars are?
Boys and girls.
Boys and girls, perfect. So as you can see, well, blue is male and the reddish orangish color is female. So as you can see, males, ADHD is more prevalent in males. The other thing it talks about here is that in a lot of the research has shown that ADHD is not classified itself as a learning disability. For a lot of people, even if it is, it's a lot of times associated with other learning disabilities. So this shows kind of how the first is kids who have ADHD but do not have another learning disability associated with it. And then may have a learning disability but no ADHD and then both. So that's just kind of a general idea of how prevalent it really is. And these are the symptoms. Like I said, lack of attention. So there's some little examples there. You may have a hard time getting your work organized. You may forget a lot of basic things like when you have a test or when homework may be due. Hyperactivity, you may fidget a lot or squirm around in your desk. Difficulty doing things quietly. So like they may flourish in big class discussion or things that involve them getting up and doing things. But if you're just at the front of the room talking and you're asking the students to sit there quietly and listen to you, there could be some serious struggles there. Impulsive behavior, like I said, blurting out answers, having a hard time waiting your turn for something. Those are common symptoms that can manifest themselves.
Okay, so we're talking about some treatments for ADHD, and I want to start out by saying it is incredibly subjective. Like, this, like, it's very, very difficult to understand exactly how to treat students with ADHD. I know everything we talked about is subjective. This falls right in, if not more so. Basically, so there's different ways to treat. There's stimulants and non-stimulants. I'm going to kind of go through it with a little diagram, if you will. So pretend this is your brain. It's right there. So everything starts. Then you have information that makes you distracted or inattentive. You have other things that can make you hyperactive. And then you have other things that will make you, what's the other one? Impulsive. So you have all three of these things that are coming out of your brain, but like you'll register them, and then your brain kind of shoots out like responses. And you're supposed to have this thing like a speed bump, kind of like slowing it down, like little controllers to like slow down what's happening, right? But these stimulant drugs basically will stimulate the controls because in some students with ADHD, those controls don't work. sounds kind of contradictory that you'd stimulate an ADHD child, right? But in this case, you were stimulating the parts that control it. So it's not, and then you have the non-stimulant drugs, which would like just prevent everything from happening at all. You wouldn't have any, you would slow down the destructibilityness and all those kind of things. And then so your stimulants are like your Ritalin, your Adderall, those things that are more common. And then there's different types of non-stimulants, and we're going to look at one right now that I found incredibly fascinating.
We're thinking about these arrows, like Bradley was saying, it's very subjective. If you imagine them as like scales and like trying to identify a student with ADHD, they can have, just like autism out the spectrum, imagine each one's a spectrum, they can be at different levels on each one, so they might be fully hyperactive and not so intent. So that's why it's kind of hard to say, like you said, it's very subjective, you're for sure having ADHD, because when you go through like a 3 out of 10 on levels. So, it's something to think about.
We're going to look at a video that I saw this summer, actually, at the Teaching Fellows Conference. So, yeah. I'm going to skip part of the time, so you'll be able to see.
There are diagnoses at near epidemic proportions for kids in this country: ADD and ADHD, attention deficit disorder, and attention deficit hyperactivity disorder. Fair or not, they are so common as to become part of the vernacular, referring to our collective short attention spans and inability to focus. Don't mind him, he's got ADD. According to a member of the American Academy of Pediatrics, when our nation's doctors encounter a patient with one of these disorders, they go right to one drug, methylphenidate. You may know it better as Ritalin. But there is a lesser-known treatment, one that may, in fact, be more effective with fewer side effects. Cannabis. You may know that better as weed, reefer, Mary Jane, marijuana. Dr. Claudia Jensen is a clinical instructor at the University of Southern California and a practicing pediatrician who advocates the use of medicinal marijuana for the treatment of ADD and ADHD. Dr. Jensen, good evening.
Hi, hello. How are you?
This is something you feel strongly about. You even testified before Congress a few weeks ago on the use of medical marijuana. What led you to the conclusion that this is a viable treatment for this disorder?
Well, that's what patients reported to me, so I listened to them. And I started paying attention and asking more questions when I did patient interviews. It seems to be rather consistent. They keep saying it over and over again.
There are...
Alright, there's more, and it's a very interesting video, and it talks about different ways of applying it that if nothing else are really funny, because they talk about cannabis cookies, peanut butter with weed in them.
Give them to the kitty.
And you know, and she goes on to say how like you don't get the kids stoned, like you want them to just have like the right amount of dosage. But I just thought it was very interesting kind of treatment because it kind of shows an attitude towards ADHD. You know, like what does weed do? Has anyone seen someone high on weed before? I don't know, a little slower, right? So you take a really hyper person and you just mellow them out. So I think it's a very interesting one. Of course, there's lots of stigmas that come along with marijuana all throughout. She talks about how like smoking it would be just like a travesty. But yeah. Okay, so another way, a type of treatment is called behavioral treatment, and this is mainly for like parents to do with students, the kids, because like it's not just in the classroom, it's not just in the doctor's office, it's a lifestyle, which is how the treatment should be. It's not always available to students as families range and attend on this, but you just create a routine. You can get organized, avoid distractions, limit choices, change your interactions with your child, use goals and rewards, discipline effectively. That's kind of like you were talking about the child with autism or Asperger's, how your teacher just yelled at them. You can't just do that because just because you're getting frustrated with them doesn't mean you can just be like, stop it right now, I told you to put that pen down, no, stop. Like, that's not going to help them. They're not going to respond. They're just going to freak out and then get more distracted. Help the child discover a talent. And the going on walks was something I found, like, as I was like looking at stuff, there's always comments at the page of people who didn't give their kids medication. Just that I go on walks and talk to my kid. That's not necessarily treatable for everyone, So just like, slowing them down, but giving them attention at the same time. It's just very important. And Wesley's going to talk now about like how you can translate this to the classroom, because again, this is such a subjective thing. Individual, like case by case study, it's very different.